Is it normal to spot during my first trimester?
It is normal to spot in the first days when the embryo implants, though it often means the vaginal discharge is orange or pink because blood mixed with the normal secretions.
I'm past that point.
If you're up to the point where the early pregnancy tests say yep, you're pregnant, there is the possibility you'll still spot as the menstrual cycle is turned off.
If my period starts, I've lost the baby.
It is estimated that that happens half the time. And yes, you could have spotting in the first month because you got pregnant and did not stay pregnant.
I'm past the first month, but I'm still in the first trimester. I've heard spotting is normal and that it is something to run to the doctor for.
Heavy bleeding like a period past the first month is a sign of something wrong, though whether a miscarriage or detached placenta, only the doctor would know.
I do not even know what a detached placenta is.
Sometimes the placenta detaches from the uterine wall, causing heavy bleeding like a period. But it can be heavier than a period and even life-threatening.
To the baby, of course.
And to you, so if there's blood gushing, rush to the ER.
Or have someone else take me. But I'm only seeing spotting, not enough blood to suit a horror movie.
You can have some spotting from an infection, like an STD flaring up during pregnancy.
That requires treatment too.
And sometimes it is due to tears in the vaginal wall.
I'm already pregnant, so what could be tearing it?
Sex while pregnant might, and straining and stretching as the kid grows and you try to do the yoga moves you used to.
I'm already having trouble reaching down and around. I'm not going to do contortions.
Spotting could be a sign of ectopic pregnancy, as the fetus grows where the body cannot accommodate it, so it presses on surrounding tissue and you get bleeding.
I've heard of women going in thinking they had appendicitis with that.
If the bleeding is accompanied by constant pressure and pain, you do need to go to the doctor, even if the blood is only spotting right now.
Any other causes I need to know about before I get paranoid?
The spotting can be triggered by hormonal changes.
As if pregnancy is not the biggest one I could deal with.
And if you're constantly chafing and rubbing down there because of a yeast infection, you could see spotting because you've essentially scratched the surface.
At least that I can treat over the counter.